Diarrhea is the second most common cause of death in children under age of 5. Diarrhea is when stool is loose or watery and occurs 3 or more times in a 24-hour period. There are many causes of diarrhea, but we will cover most common and most important ones. Viral infections are the most common cause of diarrhea. It occurs 30% of cases. Severity usually moderate. Blood in the stool occurs very rarely, but stool usually watery. It can cause dehydration, and dehydration can have serious consequences, electrolyte imbalance, and even death, especially in children. Length of condition usually lasts for several days, from 2 to 7 days, and most cases viral infections are self-limiting. Most common viruses which can cause diarrhea are rotavirus, norovirus, and adenovirus. Rotavirus is especially important in children, and we have vaccination against rotavirus. Viral infection diarrhea usually have sudden onset, watery diarrhea, vomiting, and sometimes fever. Symptoms usually last 2 to 7 days. It can affect any age group, but more common in children. Bacterial infection is second most common cause of diarrhea. It occurs 30% of cases. Its severity can be severe. Many cases blood in the stool. It can cause dehydration and length of condition usually more than 5 days. It can last up to 2 weeks. Most common cause of bacterial infections are Escherichia coli, Salmonella, Campylobacterium, Shigella. Hallmark of the disease is diarrhea, which occurs suddenly, abdominal pain is severe, fever is common, and vomiting is common. Stool culture is best way to diagnosis. Treatment is antibiotics. Condition can last 5 to 14 days. It can affect any group of age. Third most common cause of diarrhea is parasitic infections. Parasitic infections can be severe abdominal pain and abdominal cramps. Blood in the stool sometimes occurs. It can cause dehydration, and length of condition is too long. It can last for several weeks if left untreated. Most common causes are Giardia, Cryptosporidium, and Amoeba histolytica. And hallmark of the disease is persistent diarrhea, abdominal cramps, bloating, and weight loss. Diagnosis is stool examination for parasites or its eggs. Another common cause of diarrhea are food intolerance or allergy. It can occur in 15% of cases, severity usually mild. Blood in the stool is not common for such condition. It can cause dehydration sometimes, and length of condition is short, usually self-limiting. Most common agents on which person can have food intolerance or allergy are lactose or milk, gluten or wheat, and allergies any food, almost any food, especially nuts, chocolate, and such eggs and such allergen foods. Another common cause which can cause diarrhea is irritable bowel syndrome. Irritable bowel syndrome usually described as alteration of diarrhea and constipation. Another common cause is medication side effects, and we should mention several medications such as antibiotics, antacids, antihypertensives, non-steroidal anti-inflammatory drugs. These drugs can cause diarrhea. Diarrhea usually mild and self-limiting, and it's strongly correlated with ingestion new drugs. Inflammatory bowel disease is much rare but serious condition which can cause diarrhea. Diarrhea severity is high. Blood in the stools occurs in many cases. It can cause dehydration. It can cause severe abdominal pain. Uh, Diarrhea is usually bloody and it can cause weight loss. Diagnostic criteria are colonoscopy, imaging studies, and laboratory tests. Ulcerative colitis and Crohn's disease are most common cause of inflammatory bowel disease, and it has usually autoimmune basis. Prevention of diarrhea is good hygiene practice like hand washing regularly. Also, drink treated water and avoid unclean situation and poor sanitation. Vaccination of rotavirus is type of prevention which is important, especially in children. Dehydration and electrolyte imbalance is important, and we need to spot if dehydration occurs. Symptoms are thirst, dry mouth and throat, dark colored urine, decreased urine output, fatigue and weakness, dizziness or lightheadedness, rapid heartbeat and rapid breathing, and sunken eyes. Treatment of diarrhea include oral rehydration solutions, which is important, replace lost fluids and electrolytes, loperamide, and other antidiarrheal drugs such as bismuth preparations sometimes can help. Probiotics also helps and important to restore gut balance, especially if diarrhea is caused by antibiotics. Antibiotics are prescribed sometimes if there is suspected on bacterial infections, antiparasitic medications if parasitic infections. Ciprofloxacin, azithromycin, and metronidazole are usually empirical treatment. Zinc supplements also important. Zinc supplement can is recommended especially in children because it can reduce duration of diarrhea. That's all today. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.